everyone, and welcome back to PHAMCAST. It has already been, if you missed the first segment, you're going to want to rewind or go back and take a look. Here with Dr. Vineeta Ahooja, cardiologist, also doctorate in natural medicine, and really diving deep into cardiovascular health, both from the lens of prevention as well as culturally, how we avoid going and push our symptoms off. And right now, I really want to dive into, this ripple effect, this what we're calling a RIC effect, of people going to get checked because they've seen one of their friends, their peers, their family members go through something really serious and really hard. It scared them enough to act. And one of those people, just yesterday, after seeing you a couple of months ago for a consult, really didn't have reason to go, but thought he should. In hindsight, he told me he was probably feeling some things that he kind of just ignored. How human of him and how common. And then yesterday, after following your advice and going through testing, he was having different symptoms. He has drastically impacted his health, his metabolic health, through his lifestyle changes that you suggested. Can you speak to that and really talk about that role? And like we talked about in the first segment, you're giving power back to the hands of the person you have the privilege of working with. Mm-hmm. That matters.
Yeah, it is so important that we put the power in the patient's hands because, as you mentioned, that gives you this opportunity to look at your life differently. It's sort of a reality check that, hey, where am I with my health? Am I as good as I think I am? Maybe not. You look at the panels, you look at the metabolic profile, you look at the stress test, and you say, hey, these are things that I really need to focus on. Otherwise, in the next 5 to 10 years, I'm headed for another completely different trajectory.
Right.
So putting that power back in the patient's hand is so important. And he also gave us permission to just to add his case to this ripple effect and share the story that once he knew what his metabolic panel looked like, and which way he was headed, aggressive changes were made lifestyle-wise. So intermittent fasting, adding more fiber to the diet, exercising more, just getting out there, trying to do some meditation, calm down the stress levels, communicate with people around him as opposed to just, I'm working 9 to 5, come home, do my thing. No, engage with society, get that mental stress piece down. And the difference it made in 60 days was phenomenal.
Yeah, and in his blood work, like we're talking real.
His metabolic profile.
Reversed his metabolic profile.
Yeah.
In the hands, his own hands.
Normalized it. LDL was down, triglycerides down, A1C down. That could have been a whole different story had he not checked it.
And this is why, this movement and this show and these conversations matter. And as I always say, the patient is the most important member of their healthcare team.
And not to mention, Mark, once diabetes starts, and it's well into it's rising from 6 to 6.5 to 7, it's harder and harder to reverse that.
Yes.
You have opportunities in the insulin resistance phase where we can reverse our metabolic profile and bring it back to normal.
Oh my gosh, I love this conversation. So one of the things I love about you and what we're doing in FAM and with all the varied FAMbassadors is this whole concept of collaborative care. I am completely honored to be leading this movement as a massage therapist, and here I am speaking to a cardiologist. You have referred to me. I've referred to you. People don't think that's possible. Optometrists referring to massage therapists, referring to cardiologists, referring to gynecologists. Breaking down the silos in healthcare is long overdue to happen.
Mark, you have single-handedly broken down so many silos just in the last year.
Thank you.
Since I've known you.
And thank you. I'm not doing that alone. I felt called to do something when I sold my clinic 3 years ago to really, I've always been raised, you don't complain about something you don't actively do something about. And my 30 years running, Wallace for Wellness, I knew and saw thousands of patients and had all kinds of practitioners working under one roof. I learned from them, I grew from them, and as a result, patient outcomes were better. That's why I started the FAM movement, and it has been humbling. This is year 4 coming up, to see now 80 plus healthcare professionals stocking the toolbox of Canadians. But what I love more is the accidental fallout, which is brilliant, which you just talked about, which is us learning from one another, which is us referring back and forth so that we can all work better together with one outcome, which the patient outcomes. And we're seeing that in what we're doing together. I want to thank you for being that kind of specialist, to be open to even want to do that, because that can be scary because there can be judgment in the conventional medical community when you start to, or I shouldn't say that, I certainly have heard that from a lot. Has that been your perception?
Well, Mark, even within the conventional medical community, there are issues. And this has been an observation that we have these advisory boards where all the cardiologists will get together and give their opinions, or all the nephrologists will get together, or all the endocrinologists. And the meetings that have had the greatest impact were the multidisciplinary meetings, where the endocrinologist, nephrologist, gynecologist, and cardiologist are all in one room sharing stories, sharing cases, and understanding things, because everyone, including massage therapy, is so super specialized now. It's so niche focused that if we don't share our knowledge, we're all training for nothing.
Yes.
We're training single-pointed, laser focus, and we're not expanding knowledge for each other. And that's what a community is, right? We share knowledge and we grow as a population. We grow in the right direction.
And that's what healthcare is.
That's what
not
healthcare,
sick care.
Well care.
Exactly.
Health span.
Health span. And and then we can look at precision medicine and personalized medicine, which I know is the future, medicine 3.0. So let's talk a little bit about that whole diagnostics. And it's an exciting time in cardiology we're looking at things a little bit differently in terms of, cholesterol, and let's break that down for the average person. The go-to standard of care is to be put on a statin. There's lots of reasons for people to have buildup of cholesterol, bad cholesterol. Can we talk a little bit about, from your perspective, from that more integrative look that maybe perhaps even some other cardiologists wouldn't necessarily say? Can you break that down a little bit for us?
Sure. So looking at cholesterol from an Ayurvedic perspective or from a functional medicine perspective is a completely different conversation than looking at it from an allopathic perspective. Right now, the hottest thing in cardiology is looking at the genetic risk markers, which include lipoprotein A and apolipoprotein B, which are add-ons to the current lipid profile. Your standard lipid profile includes triglycerides, HDL, non-HDL, LDL, your total cholesterol, but when you add on lipoprotein A and ApoB, you get some other information. So after age 5, lipoprotein A can be genetically elevated and remains elevated throughout your lifetime. If it's elevated after age 5, it usually stays at that same level throughout your lifetime. There's a few exceptions. Menopause is one, which we'll be talking about later. So lipoprotein A spikes during menopause. But apolipoprotein B is interesting because that's another genetic marker that tells you how sticky the cholesterol is that you have. How likely is that cholesterol to deposit in your arteries? So periodic checks of apolipoprotein B when the LDL is high are also important. Yes. And these are markers that are generally not checked on the standard lipid profile. It gives you clues. So if the lipoprotein A is elevated, it means your chance of cardiovascular disease in your lifetime is escalated. Similarly for apolipoprotein B. So again, opportunities to intervene and say, even though my lipid profile looks normal, my lipoprotein A is elevated. I need to exercise harder. I need to get more nutrition. I need to get more rest. I need to make sure that I'm meditating or doing some form of relaxation therapy, so that we can prevent or reduce that escalated genetic cardiovascular risk.
Oh, music to my ears. And what's incredible about this is, once again, the empowerment piece, because currently, what is the standard of care? So if somebody, I know what it is, it's kind of a rhetorical question from me asking it, but the average person, when they go and they have this panel done, and a statin is the standard of care, is it not, to prescribe?
It is if the LDL, if things are elevated, yes, we usually add a statin.
Yep.
But there are outcome studies that are supposed to be, I think at the end of this year, they'll probably be announced, or the following year, looking at, are cardiovascular outcomes really impacted if we change the lipoprotein A levels? So stay tuned for that, because we'll have that information hopefully within a year. And that will change the therapies that we use to lower lipoprotein A.
Yes, and I think it's also the mindset, because in the current system and the way we've been trained as everyday people to engage with our health, it's very passive. We go to our doctor or cardiologist and fix me, doc. And we don't want to take ownership. What do you mean I have to move my body, eat differently, sleep more, reduce my stress? And once we take, and I'm not against, you know me, I'm a science girl, there's a place for all of this. Pharmacology plays a role, and thank goodness we live in a country where we can have access to that when acutely needed. But the problem is switching the mindset of, we just take a pill for an ill and wait till it's broken, versus, well, hang on a minute here, it has a place, but I need to get into action with all the other things.
You're so right. It's a small percentage of people that actually look at it and like Ross and say, I want to take action and I want to fix this situation. It's a small percentage. The majority, I'll tell you what I feel is the reason why the system is broken. If you look at our lifestyle, we're working in North America these long hours. You go home, you turn on Netflix or whatever your fancy is, like movies or whatever. You got this kitchen attached to your great room. Like all construction is built that way now, where your couch is right next to your kitchen.
Yep.
It's strategically designed to make you want to snack and watch movies, right, when you get home. And that's your relaxation in the evening. So people assume this is a normal lifestyle, that in the evening this is what we should be doing, instead of sitting around a table like our parents did and having a nice meal together and engaging with each other, and not on digital media, like not on your phone all the time, not in front of a screen. So we're missing many parts of that. The four wheels of a car is how I describe it. You need the nutrition, you need the community, you need the relaxation, you need the rest, you need the movement. So if those wheels are off kilter,
we crash.
Where are we headed? And then we go to the doctor and say, fix me, because this is what everybody's doing. They're watching the game, they're eating wings. This is what everybody's doing. So why is it abnormal? Why is it causing me harm?
Right.
The understanding that this is causing us harm, the lifestyle is causing us harm, that needs to be understood. The ultra-processed foods, the sitting on the couch, in front of your screen all the time, not sleeping at night, scrolling at 10 o'clock at night before you sleep, not waking up before sunrise, not getting sunrise, and not getting sunshine in the morning. All of these things have now become normal. After the 1970s and 80s, I would say, is when it really shifted. These things have become normal, and they're not healthy.
33 years ago, when I graduated from massage therapy, and I wouldn't even hang my diploma because it said masseuse, and I had a much different vision of what the power of touch could do for health and people, and I had a vision of where I wanted to take it. But here's what I also knew, and which is what you just spoke to. It was seen as woo-woo medicine to really have the opportunity to spend one-on-one time with somebody as a healthcare professional, laying on of hands, feeling, seeing, hearing, validating, and encouraging them to pay attention to their body so that they could then move their body or eat differently or refer them to someone to see a dietitian or a nutritionist. We've come a long way in the last 30 years, and I'm so proud of that. But we have ways to go still. And thank you for saying that literally we're killing ourselves by our choices, our food supply chain and what it is, because people want convenience and want a quick fix. Yeah. What we need to recognize, and I know this sounds cliche, but we either invest in our wellness now or our illness later.
That's exactly right.
And we have the opportunity with these new testing and people like you and even just the fact that we are having conversations like this enable people to get into the driver's seat of their health. And that is so, so exciting. Yeah. You said to me before we started the show today that what a difference 10 years has made. Can you speak to that from a lens of a cardiologist, and how the landscape is changing? And does that excite you as a cardiologist?
In cardiology, in all of medicine, allopathic medicine, the technology is improving at such a rapid pace, because imagine how many research papers are published daily. It's enormous.
Yes.
So keeping up with all of that is difficult, but the major things that are coming up are really exciting, because you get to see, it's sort of what you described earlier. It's precision medicine, really fine-tuning the approach to risk.
Yes. And what does collaborative care mean to you as a cardiologist? You've talked about the fact that those interdisciplinary meetings, you always got the most out of them. I've watched you in your office. I've seen how you care for patients with compassion, but I've also seen you orchestrate and do things that I haven't seen others do. What does collaborative care mean to you?
To explain that, I think we have to go back a little bit into the early 1900s, when everything sort of changed and modern medicine developed, because the intuitive sciences, I call them intuitive sciences because holistic medicine was exactly that. It was based on thousands of years of understanding of the human body as a whole, and not targeting the kidney, targeting the liver, targeting the heart. It's looking at the body as a whole, which is how we look at it in Ayurveda as well, but there's an intuitive science behind that as well. And that became known as hocus pocus in the early 1900s. And modern medicine was trying to basically put a standard on things and say, you know what, we're not sure if this herb is safe for you. It might have contaminated heavy metals, or we're not sure if this dose is right for you. It's not even standardized. So taking away the customized approach, it went into a cookie cutter approach because they could do large scale research. And that led us to some amazing breakthroughs in cancer research, in cardiovascular research, in so many realms. And we are where we are today because of that science. But unfortunately, holistic medicine got pushed to the backside, and now it's coming back up. It's starting to see the limelight again. And that's where we have a huge opportunity for collaborative care to bring together everyone who's done their training in different sciences and just understand better. How do we customize care for the individual and take away that whole, have less of a cookie cutter approach and really look at the individual as a whole and treat the individual and not the system.
And I know you believe this because we've had this conversation and I've seen it in the way you practice. And you believe that one of the most important members of that healthcare team, as do I, is the patient.
Yeah, it is the most important. They're the ones with the issue, they're the ones who are going to need to understand the issue and take it into their own hands and move forward to prevent.
And they're the ones that need to listen to their body. And you know, it's really, it's sad, but it's hopeful, I think. We have to teach people to listen. And that's one of the roles I think massage therapy plays, is really bringing people back into their body. You know, our bodies are a house for our emotions, and over time that can manifest as disease, dis-ease. And a massage therapist laying on of hands, we see emotional releases. I'm going to write a book one day to showcase what I've experienced. It's just such a privilege to do what we do. But people are disconnected from their mind, from their body, from their soul, and that is medicine. And so it's so important, isn't it, to have them part of the conversation intimately, but also celebrate when they start to do the work, because it is work.
It is, and you know, illness for the longest time for many people is sort of, they feel embarrassed to talk about it.
Yes.
They feel embarrassed to seek help for it. They want to be perfectly healthy, and they don't want to share any weakness with anybody. It's understandable, but we have to get past that. And we're all flesh and blood. We're all capable of developing certain things. We all need to band together to make the whole population healthier.
Yes.
Right. So, and that can only happen with collaborative efforts.
Yes, and collaboration in healthcare, and what FAM also does with FAM Partners is collaboration with communities, businesses, government and policymakers. I mean, this is, although a grassroots movement, it has taken on a life of its own because it struck a chord, and it's a very inclusive and comprehensive approach. This isn't going to happen overnight, but it person by person, doctor by doctor, politician by politician, community by community, together we can be the solution to change the future legacy of healthcare.
I love everything you're doing, and the number of people that you've already brought in to the PHAMCAST to share their stories and share their experience. That's just, it's taken us miles within a year that I've met you.
Oh, well, thank you. We're not finished yet. This conversation's not over. When we come back, we're going to have Dr. Christy Prowse, OBGYN and functional medicine trained physician, join us here at the table, because hormonal health plays a massive role in cardiovascular health. We're going to unpack that. We're going to look at it also from the women's lens. All those women out there with perimenopause and menopause. I went through menopause at 39, and I've got to tell you, it's not for the faint of heart, and these conversations matter. Stay tuned, because we'll be right back here at PHAMCAST.